Aiswael everyone, which is good day in Helcamelum, which is the upper river dialect of the language of the Stolo people, who are the people of the river. And they're the guardians of the land on which my university resides and the land on which I work, live, and play. So yeah, I'm excited to talk to you today about wildfires and a little bit about health impacts and sharing some of the tools and resources that we have in Canada and British Columbia with the hope that maybe of benefit to you. So wildfires are a big issue in Canada and in British Columbia. And what you can see in this graph on the x-axis is we have year, and on the y-axis we have annual hectares burned. And this shows currently between 2015 and 2022. And what you can see when I layer on 2023 is there was a significant increase in the area burned in Canada. And in fact, 18.4 million hectares of area were burned in Canada in 2023. And to give you some geographical context there, Washington State is 18.5 million hectares. And actually, this horrific year in 2023 was attributed to anthropogenic climate change, which was associated with an increase in mean wildfire season temperature of 2.2 degrees compared to the previous 20 years. And 2025 is just up until July 11th this year, and it is projected to be one of our worst fire seasons on record, and you can see that it's already surpassing many of the historical years here. So when we think about wildfires and health effects, the risk is disproportionate. And some of that reason for the disproportionate risk is physiological and biological. So as a physiologist, I do always have my physiological lens on when we're thinking about health and we're thinking about risk. So anytime we think about risk, especially in air quality, you always think at who's at either end of the spectrum. And that's why seniors and children are at an increased health risk from wildfire smoke exposure. There are data to suggest that the respiratory impacts are more prevalent in women compared to men. Other groups at risk, those who are pregnant, Indigenous populations, those who live in remote areas, those with pre-existing health conditions, those of a low socioeconomic status, and then obviously people like wildland firefighters who are often in the field fighting these fires with no respiratory protection, just because of the interaction of their work in the heat and the inability to wear it. It's probably of no surprise to you that wildfire smoke increases mortality, which is another way to say premature death. And in fact, this study here, they used data from 43 countries from 2000 to 2016. So just bear in mind that they didn't even include, or as this was published, they didn't include data more recently. And we know that the intensity and prevalence of fires is more intense now. So, but anyway, from these data, they found that over 33,000 annual premature deaths were attributable to acute wildfire-related PM 2.5 exposure. And that 33,000 number is similar to the number of people in Europe who die each year from antibiotic-resistant infection. So it's not a benign amount. It'll be of no surprise to you that it's similar in Canada as well. So wildfire smoke also increases premature mortality in Canada. And this study here partitioned it into long-term and acute exposure. And what they found was that long-term exposure to wildfire smoke contributed up to 2,500 premature deaths in Canada and up to 1,700 in British Columbia. With acute exposure, we're looking at up to 240 deaths in Canada. Most of those are in BC, being up to 170. And to provide you with a context of the 170 in BC, that's about 2/3 of our annual road traffic accidents each year that cause death. So, also not a benign number. What I'm going to share with you now is a summary of what we know to date are some of the health impacts of wildfire smoke. So the first one, when I think of wildfire smoke, the obvious one are what we call direct damages. So what we're thinking about here is burns or death. And a couple of things I want to highlight to you as I move through this schematic here is I created it using data from the following sources at the bottom. But what I've done is you'll see as I move around each health impact, we've got confidence, which is what is the level of confidence in the data, and impact size, what are the public health impacts. And I won't explain that to you as we move around, but I wanted to highlight to you that that was there, and it's largely based on the data in these papers here. What makes, I would say, wildfires unique compared to other sources of ambient pollution is they do impact mental well-being. So what we're looking at is wildfire smoke is associated with an increased risk of mental illness, so things, for example, like post-traumatic stress disorder. It's also associated with increased risk of anxiety and depression. And then there are unintended consequences of things like community-wide evacuation alerts that just wouldn't occur for other types of pollution that can impact mental well-being. And in these instances, females are often disproportionately affected. And as you can probably imagine, if you were in a community that was evacuated, these impacts on mental well-being are going to be persistent beyond the time when you can go back home. Now, there are respiratory impacts as well, no surprise to any of you that are familiar with air pollution literature, but what we see is impairments in lung function. We also see increases in oxidative stress and inflammation, which is not a surprise because that's one of the ways in which PM 2.5 from air pollution does impact our respiratory and cardiovascular system. We also see increased risk of respiratory events. So what we're talking about here is we're talking about hospitalization, physician visits. We're talking about respiratory-related mortality. We also see increased medication dispensations. No surprise, those with pre-existing conditions are going to need their medication, especially those with, we see increased inhaler dispensations. There's also, probably unsurprisingly, an increase in healthcare utilization for those with asthma and COPD. And the one that I think catches people off guard is this one at the bottom, actually, is there is only a very small amount of data, but it does suggest that exposure to wildfire smoke can subsequently increase your risk of influenza months later. So maybe there's something going on with immunity. So with these respiratory health impacts, it's important to equip the public and public health professionals with tools that can help them manage risk. And so with that, in BC, we have what's known as a BC asthma prediction system. And what it does is it allows us to look at current and projected air quality shown on the left over there. And you can do this for your selected health authority. And what it allows you, I'm not going to go through these were just a visual illustration of what you see if you go to the BC Asthma Prediction website, but it also allows you to look at projected and absolute health outcomes. So here we're looking at or respiratory-related outcomes. So here we're looking at inhaler dispensations and physician visits. And so the idea of a tool like this is to better equip both the public and public health practitioners to be able to prepare for wildfire smoke when it's here. So I wanted to share this graph with you here. So what you see on the x-axis is mean PM 2.5. And again, that's one of the primary pollutants released during wildfire smoke. And on the y-axis, which is the vertical axis, we have the relative rate of asthma-related physician visits. And what you can see is this relationship is not curvilinear. And this relationship is not linear, it is curvilinear. So the reason that I want to mention this is the media and public health gets a lot of attention when concentrations are really high, and that is absolutely important. But less than 20% of asthma-related visits occur when PM 2.5 concentrations exceed 100 micrograms per cubic meter. But more than 35% of asthma-related visits occur between those lower concentrations of 10 to 30 micrograms per cubic meter. Now, don't be mistaken, I'm not saying we do need to pay attention to higher concentrations. We absolutely do. But as quoted in this paper is we need to think about managing exposures whenever we are exposed to wildfire smoke. Because if we ignore those lower concentrations, we are ignoring a really big health burden. So there are cardiovascular implications of wildfire smoke, and I will say that the data here are mixed. There are probably less studies compared to the respiratory, so who knows if this will change, but there are some studies that show an increased cardiovascular risk and an increased risk of cardiovascular emergency room visits, particularly for those over 64. There are implications on pregnancy and birth outcomes, so an increased risk of preterm birth and lower birth weight, as well as reduction in sperm quality and fertility. And again, those data there are small, but they are there. And then there are other areas as well, so increased risk of cancers, impacts on cognition, skin irritation, eye disease such as dry eye disease, as well as a study suggesting increased risk of diabetes hospitalizations. So considerable number of health impacts. So what often gets asked or people think is PM, I've abbreviated particulate matter to PM here. Is it different than other PM? So from other sources. Two things to think about from wildfires is one, often concentrations of exposure are higher from wildfires and we can't control the source. So those two things alone will suggest that, okay, health impacts of wildfire smoke might be different than other ambient sources of air pollution. But there are actually some data, and it's in vitro data or animal data, so in cells or animals, that do suggest that air pollution and particulate matter from wildfires is more toxic to the lung than other ambient sources, so say traffic-related pollution. And in some of these data, they showed an increased toxicity by an increase of neutrophils in the lung, which is a white blood cell that's important in our, plays a role in our inflammatory response, and also increased edema in the lung. And actually, some data shows that PM toxicity in the lung can be 3 to 4 times greater than from other ambient sources. And so what is proposed to happen is it impacts macrophages in the lung, which are a really important part of our lung defense system. And it does this through a process of oxidative stress and possibly inflammation, which is a similar way in which other sources of ambient particulate matter impact health. And in fact, this study here showed that a 10 microgram increase in PM 2.5 increased the number of respiratory hospital admissions by 10% if the PM 2.5 was from wildfire smoke, but less than 1% if it was from non-wildfire smoke. So the authors of this paper suggested for respiratory hospital admissions, wildfire smoke could be 10 times, up to 10 times worse. So with the potential health implications of wildfire smoke, it's really important that we're able to equip public health authorities with the resources and skills to help manage the risk. So in 2024, the Public Health Agency of Canada came up with a toolkit for public health authorities. And you can see I've got a QR code here. At the bottom, you can take a picture and all the resources are listed. But what this toolkit does is it provides health authorities with information on prevention and risk mitigation, preparedness, as well as response. So it's better equipping people at more of a community local level to help with the management of the health risks in relation to wildfire smoke. I'm just waiting for the phones to drop. The QR code will be up again in a minute. Okay. So this schematic here shows you of the many, many ways that wildfire smoke could impact mental well-being, or some of the pathways in which that could happen. I'm not going to go through this, but what I wanted to highlight, one of the ways is through reduced physical activity. And in a study that I conducted, we found that on a typical day with wildfire smoke, participants reported less leisure time walking, less moderate and vigorous physical activity, less outdoor exercise, and less bike commuting. And this was accompanied by increased symptoms of stress, anxiety, and depression. And in terms of how much physical activity, it was about 20 minutes less on a day with wildfire smoke for moderate to vigorous. And that's not a benign amount. So let me contextualize that for you. Over the long term, accumulating 22 minutes of moderate to vigorous physical activity offsets the mortality risks of sedentary behavior. Acutely, even reducing by that amount of activity for 7 days can increase triglycerides. It can increase the glucose response to food. And it can also increase your response to an oral glucose tolerance test. So it's not a benign amount. And so we also found that reductions in these kinds of physical activity, as well as outdoor exercise, were related to increases in symptoms of stress, anxiety, and depression. So there's an interplay there. And in fact, we did what's called a mediation analysis, and we found that outdoor physical activity, as well as your leisure time physical activity, mediated the effect of wildfire smoke on mental well-being. So that's telling me that maintaining physical activity when it's smoky out will be helpful to help us not only maintain physical health, but also impact mental health as well. So I think from my lens here, I'm always thinking about, and I encourage you to think about as well, how can we support people to be active or safely active outside when it's smoky or when air quality is poor? So my question for you to ponder, for any of you that experience intermittent increases in poor air quality, is how do we offer free or low-cost access to clean indoor exercise spaces or N95 masks when it's smoky? So in our study, 60 to 70% used an air quality health index or an air quality advisory to inform physical activity during a smoky period. So it's great, people are using these tools. And those who use tools like this were more than twice as likely to move vigorous physical activity indoors. So you're like, great, these tools are awesome, they're affecting behavior change. But what if the indoor airspace isn't clean? We can't just tell people to go inside when the air is not clean. And remaining indoors without filtration doesn't provide sufficient protection during smoke events, especially for high-risk people. So it's multifaceted. And given that we spend 80 to 90% of our time indoors, keeping indoor air smoke-free will likely lead to the greatest health benefit. But the irony to that is in Canada and other parts of the world, there are no indoor air PM 2.5 standards that are bindable and that are required to be followed. So what that means is we are disproportionately shifting the risk, which is less equitable, to the individual level and less of a systemic level. But given that we have no indoor air standards that are bindable, then we need to think about filtering the air. And in this instance, HEPA filters are a good option, because they can reduce PM 2.5. But any of you that have purchased a HEPA filter will know that the unit is expensive and they love charging you an arm and a leg for those filters. Yeah, but before I move on to the next slide, I just wanted to highlight to you that if you are interested in knowing more about removing or excluding smoke from buildings or the recommendations of using low-cost sensors, you can go to the ASHRAE publication that's in the resource list. The reason I was complaining about cost, it was a segue into my next slide, which I disrupted a little, but here you go. There are potential DIY air cleaners that might be a more affordable option. And essentially, you can go down to the local hardware store, buy a box fan, and buy what's known as a MERV 13 furnace filter. They're still not cheap, but they are cheaper. And what makes them cheaper is it's super cheap to buy the filters to replace. And they can be effective. And this data I'm going to show you here, it's pilot data from an undergraduate thesis that was not conducted during wildfires. But what this student did was put some of these DIY air cleaners into daycares next to major roadways. And what you can see on the x-axis is we have pre-DIY air cleaner, post-DIY air cleaner. And on the y-axis, we have ultrafine particulate matter, which is a measure of traffic pollution. And so after the air cleaner was put in, it reduced traffic-related pollution. Not a surprise, really, but it shows that they can be effective and a more affordable option. And so my question is, in general, for you to ponder, how can we provide air cleaners to vulnerable groups when air quality is poor? Like what groups, what policies, what resources do you need? And I'm putting some of these questions in here today for you to ponder for tomorrow. Now, if we can't get people having clean air spaces at home, then we need to think about community clean air shelters. But for that, there needs to be some guidance, at least for local groups and local authorities, about how do we make a clean air shelter. So Health Canada did come out with a guidance for clean air spaces during wildfire smoke events, which equips people more at the local level about what they can do. And in fact, in BC, we took it a step further and we have a cleaner air spaces map. It is limited at the moment, but it allows you to go on, see if there's a clean air location next to you, and you can look at both the indoor and the outdoor air quality in there. So then another one for you to ponder would be, if you don't have something available like this, if it's not already available in your jurisdiction, would it be useful for you? And if so, what needs to occur to make this happen? And then finishing up now, in terms of messaging, I thought it was important to end on this because people in BC receive messaging about wildfires in many different ways. And it is really important for that messaging to be multimodal because different groups rely on different messaging. And so messages taken from these data, messages need to be simple, they need to be from multiple sources and have additional details available online. So my question for you to think about is, what kind of public health messaging is used in your communities when air quality is poor? Have the public been consulted on what they find effective? And is it the same for each type of air quality event? And so with that, I'm going to leave it there. There are a couple of resources I didn't get to, but they're all on the resource list. Some events lists for schools and when you're hosting an event, as well as an air quality assessments benefits tool. So I recommend you just dig around in there in case it's useful. And I'll leave it there. Thank you for listening.